So first step is to put a drop of blood on the slide. Make sure the rough side of the slide is up so you can label it afterwards, which we will do off camera. So small drop. It's probably too big, but whatever. Get your spreader. Okay, this is the part I struggle with, holding it still. So you want to start at the front, bring it back and let it fill out slightly, and then like zoom it down. So ideally it should create one thin layer of blood cells. So watch me fail miserably. It's alright. Probably not one layer, but yeah. So air dry it. You can use a hairdryer, but otherwise just wait. So you can see that I had a couple of extra attempts. This was the best one, the final one. You're not supposed to have that drop of blood there because that implies that it dries before you spread it, but it is sort of, I guess, parallel to the sides of the slide, looks to be one layer and has the feathered edges. Okay, so here I am doing the diff quick stain. That's what we use in our clinic. So I'm starting with the blue, which is the fixer, basically just sticks everything to the slide. So I just draw it up in a syringe and drop it on. You let it sit on there for a few seconds. And I don't rinse in between, just because I don't want to knock anything anywhere. Just wanted to retain its integrity. Lean it on the sink there and then move on to the red. So stain number 1. Just doing that again. So letting it spread and just showing you how that's come up there. And finally the purple stain, which no matter how hard you try will always get on your fingers. You can also use the dipping technique where you dip the slide into the actual tubs just for 1 second several times, so dip, 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 etc. Yeah, so we put the purple in there before we rinse, just let it sink in. Drip off the excess. And then we use this little squirty water thing just so it can run from the top of the slide because the tap's a bit forceful. You can spray the back just to get all the stuff off. It's also important to spray the back when you use the dipping technique for staining. Alright, and then you've just got to let it dry, so you can use the hairdryer again or you can wait. So here I am, just positioning it on the platform, using the coarse focus to get it at the right level, and of course moving the slide around until I get where I think will be one layer of cells. So it's important to do this when you're looking at the platform from outside of the microscope so you don't bump the lens and smash it. And then starting on the smallest magnification and moving up using the fine focus just gradually. I also, if you notice down the bottom, tightened the thing so less light was getting through. It helps to start on low light and work your way up. So the oil is for the highest magnification as well. Just stops it from rubbing against the slide and obviously assists with magnification. You can see me go back and forth there. It never hurts to go backwards. So yeah, just let a little bit more light through there. And I've also got terrible eyes, so I can't focus. Okay, so here you can see I managed to get it in one layer, which surprised me. I think it turned out pretty well, considering. There you go.